If your child has ADHD or you wonder if they do, you may be seeing more than just trouble paying attention. Maybe the smallest things cause meltdowns, like freakouts. Maybe school keeps calling all the time or sending emails. Maybe they can't sit still, can't calm down, or they seemed overwhelmed by normal everyday life. Now, a large 2025 research review gives us an important clue. Sensory processing differences are common in ADHD and should be explored. Now, this does not mean that sensory processing causes ADHD per se. This does not prove a cure for ADHD, but it does mean parents and providers should ask better questions, and gives us clues that restoring a more calm sensory system will commonly give these kids with ADHD a higher quality of life. Focus and attention struggles. Common ADHD behaviors that parents recognize would be like focus and attention struggles, difficulty finishing their homework, zoning out, if you know, you know, needing repeated directions, hyperactivity and impulsivity, constant movement, climbing, crashing, touching, interrupting, or acting before thinking. Now, emotional regulation struggles look like big anger, anxiety, meltdowns that seem bigger than the actual situation you're looking at. They have a hard time calming down once they're upset. Now, again, this doesn't mean they have ADHD, but these are just some of the common struggles that we see. So sensory clues are clothing that feels wrong, loud rooms that are just too much, picky or intense responses to textures on your skin, sounds, light, tastes, seeking pressure, movement, chewing on things, spinning, jumping. Now, behavior is communication. That's what I want you to understand the absolute most here, is behavior is communication. Many kids are not giving parents a hard time. They're actually having a hard time. That's what we do at Radiant Life. We help you figure that piece of it out because it's a challenge. So I want to give you some explanations of this research. And this paper is a systematic review and meta-analysis. Now, I'm not a research guy, but I do love when other people kind of package it and explain it. So I'm going to do my best for you. So published in the Journal of the American Academy of Child and Adolescent Psychiatry. Thank you. Now, a systematic review gathers the best available studies on a specific question, and a meta-analysis combines results to look for bigger patterns in all of those results of different studies. Now, this specific research involves 30 studies, over 5,000 participants, children, adults, comparing ADHD groups with control groups, so it's pretty solid. And what researchers found were more sensory sensitivity, more sensory avoiding, more sensory seeking, more low sensory registration, which is why we do the work that we do at Radiant Life. Now, some parents are listening to this and they're just like, that's my kid. Other parents are listening to this and like, wow, this is fascinating research, right? But ultimately, sensory processing should be explored when children or adults are referred for ADHD. Now, sensory overwhelm matters because sensory processing is how the brain and the body notices, sorts, and responds to information, our life around us. Sound, touch, light, movement, body position, taste, smell, external sensations, which are our 5 sensations, or internal sensations. Now, some examples might look like a busy classroom. A busy classroom can feel like too much. A shirt tag can become the whole morning. You know what I'm talking about if it's you. A child may move more because the body is asking for input. A child may miss directions because their system is overloaded or under registering input. Now, we want to connect this back to regulation And that's if the nervous system is spending too much energy just handling the room, focus and calm, absolutely, just become harder. Now, I don't want to make this sound like every ADHD behavior has to like fall in this, or every behavior has to fall under the category of even ADHD. But it's one important part of the puzzle for many kids and many parents who are just trying to figure this out. So one of my favorite topics to talk about is proprioception, the body's sense of position, movement, and force to gravity. Now we're experiencing gravity 100% of the time, so that's why proprioception is so important. It helps a child know where their body is and how much effort to use. Pushing, pulling, climbing, jumping, squeezing, crawling around, deep pressure. Now, proprioception can be an important and strongly influential part of regulation for many kids. If this system's not working well, the rest of everything else has a hard time functioning. So, I want you guys to make this connection. When this system is not giving clear feedback, a child may crash, bump, fidget, seek pressure, or feel disorganized inside, which is overwhelming for the brain. That's why we pay attention to sensory and proprioceptive function instead of looking only at behavior and calling a kid a bad kid or they're not good at school. Now, I want to talk about how Radiant Life thinks about and measures that proprioceptive input and that regulation. So we love measuring instead of guessing, because a lot of what we do in this world and a lot of professionals are guessing at things. We look for contributing factors for regulatory load in their life. We consider brain-body communication and sensory proprioceptive function. We seek clarity for the whole child and the whole family. Now, regulatory load, like the amount of work the nervous system has to do to stay calm, focused, and ready. And if you think about our nervous system, it regulates everything. Our brain, we know it regulates everything, but it uses that sensory system to know what to do. We're not using this paper to claim that our care treats ADHD. We are using it to support the importance of exploring sensory processing and how important it can be to address sensory processing issues. And if people in the category of ADHD diagnosed, or we think that they might be diagnosed with ADHD, how much they struggle with sensory processing and how much harder their world is and how much lower their quality of life becomes when they're struggling with that. Parents don't need more guilt. You know this. Parents need someone to listen, someone to measure, and help them understand what may be happening. Many times it's not your fault. Many times it's not your own child's fault. Now, what this study supports is sensory processing differences are common in ADHD. Sensory processing can affect daily functioning for sure. Sensory processing should be explored clinically for more of these cases. And what it doesn't prove is that sensory differences cause ADHD. It does not prove every child with ADHD has sensory differences. It does not prove any one treatment fixes ADHD. Now we're talking about this specific study. Some of these things that I just said the study doesn't prove. We have some good weights that sensory processing makes ADHD symptoms more intense. We have some weight that every child with ADHD has some sort of sensory processing deficit. And we have some weight that we can help people with ADHD, kids or adults. But nobody's saying we treat it or cure it specifically. Just help raise their quality of life and calm their brain down. Now, these studies were questionnaire-based studies. The results varied across the studies, and only 9 of the 30 studies were low overall risk of bias. So I want you to understand this, that good science helps us ask better questions, not make bigger promises than the research allows. If your child struggles with focus, meltdowns, anger, anxiety, or just massive overwhelm, do not stop at bad behavior. In overload, man, start with the assumption that the child is genuinely doing their best and they're overwhelmed and they don't want to feel out of control. They don't want to be a bad kid. Notice what's going on. Regulate yourself as a parent. That one can be hard. Reduce the amount of input that you're giving the child by yelling, cornering, punishing. So reduce that input. Offer them a choice. That one's huge. And then reconnect and name what happened after everybody comes down. So slowing your body down first is a huge key to this, because we want to use fewer words, lower tone of voice, or lower intensity of your voice, less anger, fear, or sadness driven reactions. We don't actually want a lot of reacting happening, because then the kid is going to feel that. Now, in regards to touch, if a kid wants firm hugs or deep pressure, that may help some sensory kids. It helps a lot of kids because they feel more connected, but touch may make things worse for a sensory avoidant child. It doesn't mean they don't love you. It just means their sensory system is so overloaded that touch is challenging for them. It just overloads their system more. So ask them, observe, and respect refusal, but be inviting. That's my encouragement. Be inviting for when you're ready for a hug. I'm here for you. So one of my favorite topics to talk about in this is like a safe space. Agree ahead of time on a calming space. Talk to them about it. Make it clear that this is not punishment, but the child can leave that space when they're calm, when they have chilled out and they've regulated again, so that you can talk. So depending on their age, their safety level, and the context of the situation is going to tell you like the time frame of what that might look like and what that space might look like. The actual regulation progress that we want to see is that a child may start naming the struggle. That's huge. A child may show more awareness after the episodes and feel regretful. We see that rapid 0 to 100 episodes. They can still mean regulation is hard in the moment, but we want to see less of those. That's when regulation is happening more and more. So I want you also, as parents, to look for patterns. Does the child appear to have a low stress threshold across several different situations? Do different triggers produce a similar overwhelmed response? What settings make it worse? What sensory input helps? That one's huge. What sensory input overwhelms? That's the more obvious of them. And does movement or pressure help them just kind of settle their system down? Are transitions, clothing, sound, or busy rooms frequent triggers? Now, I want to encourage you with this as parents. Your child is not broken. We say that all the time. You are not failing, even though it feels like it is the case a lot. There may be more going on beneath that behavior than you even realize. God created children for peace, joy, connection, and purpose, not constant overwhelm. Radiant Life is openly Christian and loving, while we welcome every single person that comes into our office, because it's hard and we get it, and that's okay. We want you to work with your medical professionals that you know and trust related to ADHD in this, who is regulating your medications or your therapy suggestions. I just want to make sure that you know that there's often things going on underneath the surface, and we can help you discover that. we wrote a plain English breakdown of the studies, or of the study for parents. On our blog, on our website, www.radiantlifeomaha.com, we wrote a plain English breakdown of the study for parents, broke it all down for you as nicely as we could. There's also a quiz on there that if you are near Omaha and wonder whether sensory stress may be part of your child's picture, take the 60-second sensory quiz. It gives you real insight. Also, feel free to contact us if you want help thinking through whether Radiant Life is the right fit. Contact our team. We have amazing people who want to talk to you and help you. Now, the goal is clarity, not another label. Let's understand what your child's nervous system may be trying to tell us. Talk to you soon.